way. So that is the major objective of today's class. Today we will learn how these electrolytes are determined in the body. Just check whether everything is fine. So is everything fine? Am I audible to you people? Hello?
Yes, sir.
Okay.
Yes, sir.
Are you able to see the screen?
Yes, sir.
Okay. So today the major objective of today's class is we will learn how electrolytes are determined in the body. Okay, electrolytes such as sodium, potassium and calcium and chloride, so these can be determined by a common method known as ion selective electrode technique. Okay, so this is an conductometric method. So that is, so as I told you, like electrolytes are carry charges. Okay, when they are dissolved in a solvent like water, so they have the ability to conduct electricity. Okay, so here, so the amount of electricity the electrolytes can conduct is directly proportional to the concentration of electrolytes that is present in the solvent. Okay, so based on the amount of electrolyte that is conducted, you can measure the amount of electrolyte that is present in. That is the very basis of this ISE technique, that is ion selective electrode technique. So here what we are going to do is we are going to place the electrodes in a solvent and we will allow only those that electrolyte which we want to measure the concentration into the electrode. So conductivity of the electricity by that particular electrolyte will give us an idea about, or will give us a measure of that electrolyte that is present in the solvent. That is the basis. Okay, so before we learn how these electrolytes, individual electrolytes are measured, we will know more about this technique as a part of basic learning. Okay, so ion selective electrolyte technique. So ISE is an analytical technique. So this is used to determine the activity of ions in aqueous solution by measuring the electrical potential. So this is the very basis of this method. It measures the conductivity of electricity by particular ions, and so the conductivity is directly related to the concentration of that particular ion. Okay, so this is an potentiometric technique. So this is used to determine the activity of ions in aqueous solution by measuring the electrical potential. So here it measures the electrical potential. So what we're going to do is, specific ion is dissolved in a solution, so to create an electrical potential. So this is measured by an voltmeter or pH meter. Okay, so the strength of this charge is directly proportional to the concentration of selected ion. Okay, the strength of this charge or potentiometric capacity is directly proportional to the concentration of the selected ion. Okay, so here, what do we do in potentiometry? What is potentiometry? Brief introduction about it. So here, electrodes are used to measure the voltages that provides. So this voltage that is measured will provide the concentration of a particular ion that is present. So that is what we are going to gather the information. That is, we will measure the voltage of the electrodes. So the voltage of the electrode increases as the conductivity of the electricity by particular ion increases. So here we are going to use two types of electrodes. Indicator electrode. So here indicator electrode is the electrode that responds to analyte. Analyte means the sample solution. So where the concentration of a particular ion has to be measured, that is unknown. So reference electrode is a standard electrode. So here we know the concentration of ions that is present in that solution. So that this electrode is dipped into that standard solution and it measures, and that will always be constant potential. So by comparing the kind of potential, that is voltage that is conducted by indicator electrode with a reference electrode, we will be able to measure the concentration of the unknown solution. Okay, so here we call it as cell voltage. It is the difference between the indicator and the reference electrode. Okay, so here most of the times we will be using silver chloride reference electrode. Okay, we are going to use silver chloride reference electrode. So here what happens when silver chloride is dissolved in water, it undergoes ionization, it will form silver and chloride ion. Silver as cation and chloride as anion. Okay, so this is the diagram of potentiometry. So here we will be using silver chloride electrodes. So this is a reference electrode and this is indicator electrode. Reference electrode, here standard solution goes in. So we know the concentration of the ion that is going inside. Indicator electrode, we don't know how much ions that are going inside. So we need to find out the concentration of ions here by comparing with that of the potential of electrode potential of the reference electrode. Okay, so in this reference, that is electrolyte solution of known concentration moves in. So here in indicator electrode, unknown electrolyte solution of unknown concentration will be moving in. Okay, so here you have liquid junction, they will be separated. Okay, so this ion selective electrode, that is ISE, consists of a thin membrane through which only specific ion can diffuse. That is, so here it will have a thin membrane. So you can change the membranes. Like if you want to allow only sodium ions, not potassium and chloride and other ions, you can create a membrane that allows only sodium ions through this membrane. Okay. So by measuring the electric potential generated across a membrane by selected ions and comparing it with reference electrode, the net charge is determined. Okay, so there are four types of electrodes available: glass membrane, so solid state electrode, liquid based electrode and compound electrode. So glass membrane electrode, so this by using glass membrane electrode, the electric potential of pH sensitive electrode as a measurement signal. So here that is glass membrane electrode uses the electric potential of pH sensitive electrode as a measurement signal. Okay, so the glass electrode is most commonly used sensor. So because it is not having many disadvantages like disadvantages of optical method, so it can be used with almost every type of ions, okay, or electrolytes. Solid state electrode, so the electrode body of the is made up of inorganic crystalline polymer. Okay, so for example, special epoxide resin with excellent mechanical properties can be used. So advantage is it can sustain high temperatures. So liquid based electrode, so this is formed a very thin layer of organic liquid like semi-solid forms like membranes like jelly. So they are impermeable to water and they only allow selected ions. Okay, so the material that can be used to prepare the jelly is carbon tetrachloride, benzene and mesitide. Okay, so electrodes, and one more is compound electrode. So compound electrode will have membrane of multiple type. Okay, so here you have this. So the membrane is so the blue colored is the membrane that is attached to the electrode. Okay, so glass electrode is inside. So glass electrode membrane will be there, and then one more outer membrane is attached. So here 0.1 molar potassium chloride electrolyte with weak bicarbonate buffer is placed, and then silver chloride electrode that is dipped in potassium chloride is present. Okay, so this is compound electrode, so it contains multiple type of membrane attached to it. Okay, so what are the electrolytes that can be measured by this? So here sodium, potassium, calcium and protons, the cations that can be measured. Chloride and bicarbonates are the anions that can be measured. So sodium is a major extracellular electrolyte. It helps in brain activity, and potassium is an intracellular electrolyte. If there is a variation in heart and muscle activity, if the doctor is predicting any deviation in heart and muscle activity, he will ask you to measure potassium level, and if there is any deviation in brain activity, then the doctor might ask to measure sodium ions. Calcium ions are prescribed when there is variation in heart and muscle activity. Protons are asked to measure when the patient is suffering from acidosis or alkalosis. Okay. Anions, that is extracellular, these chloride. So this is an extracellular anion, and bicarbonate is also an extracellular anion. So these are measured in case of acidosis and alkalosis. Okay, so usually, so when serum is used, okay, serum is used to collect. When you are going to measure the electrolytes from serum, so you need to add an anticoagulant. Usually, heparin is used as an anticoagulant to keep the blood that is drawn from the body in the fluid state. Okay, so in the sample holders that are used, they are called as vacuates. So vacuates you have seen in labs, they are used to draw blood. So why they are called? Because they create a vacuum. So there will be at the top of the lid, there will be space to inject, and so there will be self-sealing rubber. So that will be part of this lid. Okay, so they are called as vacuates. So these there are different types of heparin vacuates, that is ammonium vacuate, so that, and lithium plus heparin vacuate, sodium vacuate. So it contains sodium plus heparin. Okay, for measurement of sodium, lithium heparin vacuate is used. It contains lithium plus heparin, and ammonium heparin vacuate can also be used. So here in sodium vacuate, so when you are measuring sodium, we will avoid using sodium vacuates because that can lead to false results. Okay, so now we'll learn how do we measure sodium by ISE method. Okay, so this is a major extracellular cation. So normal values are in serum, the concentration should be between 135 to 145 milliequivalents per liter. So the function of sodium ions are it influences the regulation of body water. It helps to maintain osmotic pressure. So it influences the central nervous system activity. Okay. So how this sodium is measured in serum, determination of sodium in serum. So the first step is sample collection. So serum should be collected in heparin bulb. Use heparin vacuate or a bulb. Okay. So here EDTA cannot be used. So because EDTA is an chelating agent and an anticoagulant, but still it cannot be used because it chelates with the ions that are present in the blood, and it will give false result. Okay. So serum sodium is measured by ion selective electrode technique, that is ISE technique, using indirect measurement of electromotive force. We will measure the voltage, so that will give you an idea about the electromotive force, and this will give you an idea about the amount of sodium present. So this is an indirect method. So voltage gives you an idea about the sodium that is present in. Okay. So ISE module measures the electromotive force difference between an indicator and a reference electrode. Okay. So the electromotive force of the indicator electrode is dependent on the concentration of the sample. Higher the electromotive force, higher is the concentration of the sample. So by comparing with the standard, we will be able to calculate the amount of the particular ion concentration that we are measuring. Okay. So the EMF, electromotive force of a reference electrode, is always constant because we will be using a known concentration of a particular electrode. Okay. So the EMF generated is directly proportional to the concentration of the sodium ion. Higher the EMF, higher is the concentration of sodium ion. So by comparing with the standard, we can measure like for per unit increase in the electromotive force, the amount of sodium ion that are present. Okay. So the next thing is a determination of sodium in urine. So this is usually done, that is sodium is measured along with aldosterone in urine. Okay. So aldosterone is the major mineralocorticoid, and it is produced by adrenal cortex. So the role of aldosterone is that is it stimulates sodium transport across the cell membrane, that is particularly in the distal renal tubule, where sodium is exchanged for hydrogen and potassium. Aldosterone is important in the maintenance of blood pressure and blood volume. That's a major role in maintenance of blood pressure and blood volume. Okay. So primary aldosterone is a disorder. So this which is caused by aldosterone secreting adrenal adenoma or carcinoma of aldosterone secreting organs, or it is also called as adrenal cortical hyperplasia. Okay, so this is characterized by hypertension accompanied by increased aldosterone level, hypernatremia, that is increased due to increased aldosterone level, more amount of sodium is reabsorbed from distal convoluted tubule. So hypernatremia and hypokalemia, so this increases the blood pressure. So that is why hypertension due to increased level of sodium. Secondary hyperaldosteronism, so this is in response to renovascular disease, salt depletion, potassium loading, cardiac failure with ascites, pregnancy, Bartter syndrome. So this is characterized by increased aldosterone level and increased plasma renin activity. Okay. So this determination of aldosterone is useful to detect primary aldosteronism and secondary aldosteronism. Okay. So while collecting the sample for this, so the patient preparation. So the first thing is patient preparation. So if the patient is taking spironolactone, so that is potassium sparing diuretic. So it should be discontinued for 4 to 6 weeks before the test is performed. So 10 ml of urine sample is used in the test. So here, so this test is an 24-hour urine sample technique. So first 24 hours urine is collected, out of which 10 ml is taken for the test. Okay, so here the sample 10 ml sample is added, and 25 ml of 50% acetic acid is added as preservative at the start of the collection. So 15 ml of 15% acetic acid is used for children under the age of 5 years. So this preservative is used to achieve a pH of between 2 to 4. Okay. So after collecting the urine for 24 hours, 5 ml of this well mixed 24-hour urine is collected in a 5 ml tube, and that is labeled for as aldosterone. That is sent for to test the aldosterone level, and 5 ml again 5 ml is collected in a separate container from the 24-hour urine sample in a separate tube, and that is labeled as sodium. So this sample is used to measure sodium level in the same tube. Okay, urine sodium level, normal urine sodium level is 4 to 227 millimoles per 24 hours. If the 24-hour urinary sodium excretion is more than 200 millimoles, so the urinary aldosterone excretion should be less than 10 mcg, okay, microgram. So urinary aldosterone greater than 12 mcg per 24 hour indicates hyperaldosteronism. Okay. So urinary sodium is determined by ion selective electrode method, as we discussed previously. So using indirect measurement of EMF. Okay. So again we'll be using sample indicator electrode and reference electrode, and we will measure the electromotive force. Okay. How aldosterone is determined? Aldosterone is determined by liquid chromatography, mass spectroscopic technique. So this is LCMS technique. This is an hybrid technique, so which combines two techniques. Okay, samples. So chromatography is a separation technique where components are separated. Mass spectroscopy is a technique to identify different chemical molecules based on its molecular weight. So samples are spiked with that is deuterated internal standard. Deuterated internal standard is added and are hydrolyzed overnight with acid. So the samples neutralized and extracted by solid phase extraction method, and the extracts are dried, reconstituted and analyzed by liquid chromatography tandem mass spectrometry. Okay. So hyponatremia is a condition where the level of sodium is less than 135 milliequivalents per liter in urine, so in blood. So this is due to increased sodium loss and causes, so this can be due to diabetes mellitus, diabetic ketoacidosis, severe diarrhea and severe vomiting. Hypernatremia is that is higher levels of sodium level in serum. So excess of water loss, so in case of dehydration, so that can lead to hypernatremia. So dehydration can occur from inadequate water intake, or in case of severe diarrhea, diabetes insipidus, or due to burns. Okay. So the next thing is measurement of potassium level. Potassium is a major intracellular cation that is present inside the cell. Normal values are 3.5 to 5.3 milliequivalents per liter in serum. Function, heart muscle contraction, and increase or decrease in potassium level can cause arrhythmias. Arrhythmias means irregular heartbeat. Okay. How it is determined? So this is determined by the same method, that is ISC technique. So sample collection is done using heparin bulb, plain heparin bulb. Again here EDTA cannot be used. So this is measured by ion selective electrode method. So the method is same, I won't be repeating again here. Okay. Determination of urine potassium. So here 24-hour urine sample is collected, 25 ml of 50% acetic acid is added as a preservative. So normal values of urine potassium is 17 to 77 millimoles per 24 hours. Okay, so this again is measured by ISE technique, that is ion selective electrode technique. Okay, hypokalemia, so that is low potassium level in the blood serum. So this may be due to diarrhea or certain medications like diuretics like furosemide, or in case of dialysis, diabetes insipidus and hyperaldosteronism can cause hypokalemia, that is lower potassium level. Hyperpotassium level, that is hyperkalemia. So it may be due to acute renal failure, chronic renal failure, acidosis. In case of diabetes mellitus, acidosis is a condition where there is where the pH of the blood is acidic, and alkalosis is a condition where the pH of the blood is alkaline. Okay. So here in case of diabetes mellitus, protons compete with the potassium to get into the cells to be excreted by kidneys. So decreased insulin promotes cellular potassium loss, and hyperosmolar plasma, that is from increased level of glucose, will pull water and potassium into the blood. Okay. So calcium is a major cation of extracellular fluid inside the cell. Normal serum levels are 4.83 to 5.52 milligram per deciliter. Serum ionized calcium concentration 50% below normal will result in cardiac stroke, severe cardiac stroke. So maintaining calcium level is very, very important. With moderate to severe hypocalcemia, left ventricular function may be depressed. Okay. Function, 99% of calcium is present in bones, and calcium is an important for clotting and contraction of smooth muscles, including heart. So calcium is essential for contraction coupling in cardiac muscles, as well as for the conduction of electrical impulse in certain regions of heart. Okay, so it plays a role in maintaining the integrity of mucosal membrane, cell adhesion and functions of individual cell membranes. So how it is determined? Again by ISE technique, that is ion selective electrode technique. Okay, I won't be repeating the method. So method is same as the previous one that we discussed in measurement of sodium and potassium. Okay. So determination of calcium in urine. So normal values are less than 250 milligram per 24 hours of urine. So and calcium should be excreted less than 200 milligram per day in females. Increased urinary calcium excretion is a condition called as hypercalcemia. So this is a contributor to kidney stone disease or osteoporosis, and that is loss of calcium from bones is called as osteoporosis. And many cases are genetic, so they are called as idiopathic. Okay, so the risk of kidney stones appears that is more when 24-hour urine calcium is more than 250 milligrams in men and more than 200 milligram in women. So 24-hour urine sample is collected, so it is refrigerated within 4 hours of completion of 24-hour collection of urine. So how it is tested is, so this is calcium ions are measured by diatrimetric method. Calcium ions react with 5-nitro 5-methyl ethan tetraacetic acid, so this is called as NM-BAPTA, nitro-methyl NNN tetraacetic acid, so this is called as BAPTA. So this is under alkaline condition to form a complex. Calcium ion reacts with this NM-BAPTA to form a complex. So this complex reacts with EDTA. So the change in absorbance is directly proportional to the concentration and is measured by photometric method. Usually the photometric method that is used here is flame photometry. In flame photometry, the sample, that is calcium containing the solution, is added to NM-BAPTA is added to the urine sample. So this will react with calcium and form the complex, and then EDTA is added, then EDTA complex is formed. So and then you're going to transfer this sample into flame photometric instrument. So the flame photometer, what it does is it releases the calcium ions. On burning, it releases the flame color changes. So the intensity of that particular color is measured by using detectors. Okay. Hypercalcemia, so the nervous system is depressed and the reflex action of CNS can become sluggish. So major concern is increased calcium level can cause cardiac arrhythmia, it can cause constipation, lack of appetite, contractility, depression. Okay. So of GIT walls, so that is why it can cause constipation. Okay, so the depressive effect begins to appear when blood calcium level rises above 12 milligram per deciliter, and beyond 17 milligram per deciliter, calcium phosphate crystals will precipitate throughout the body. So this situation occurs due to hyperparathyroidism, vitamin D deficiency, osteoblastic metastasis, steatorrhea, Cushing syndrome, acute pancreatitis, and acute hypophosphatemia. Okay. Hypocalcemia, so change in blood pH can influence the degree of calcium binding to plasma proteins. So with acidosis, less calcium is bound to plasma proteins. When calcium ion concentration falls below normal, the excitability of the nerve muscle cell increases markedly. Okay. So the next thing is measurement of chloride ions. So chloride is a major extracellular fluid. So normal value is 100 to 110 milligram per milliequivalents per liter in serum, and 24-hour urine should contain 110 to 250 milliequivalents per liter, and cerebrospinal fluid should contain around 120 to 130 milliequivalents per liter. Okay. So this is a major extracellular anion. It helps in maintaining poor hydration, osmotic pressure, normal cation-anion balance in vascular and interstitial compartments. The concentration of chloride is 103 milliequivalents per liter in extracellular fluid and 4 milliequivalents per liter in intracellular fluid. So how it is determined? So in serum, it is determined by ISE technique, ion selective electrode technique, same as the previous one. In urine also, ISE technique is used. Okay, so decreased chloride concentration is called as hypochloremia. So this is due to nephritis, kidney damage, so leading to lack of tubular reabsorption of chloride. Metabolic acidosis, so that is found in diabetes mellitus and in renal failure and prolonged vomiting. Hyperchloremia is caused in case of dehydration, decreased renal blood flow with congestive heart failure, or excessive chloride uptake can cause hyperchloremia. Next thing is bicarbonate. So this is the second most prevalent anion in extracellular fluid compartment. So bicarbonate includes bicarbonate and carbonate ions, carbon dioxide in physical solution, as well as carbamino compounds. Okay. So along with carbonic acid, that is H2CO3, so bicarbonate acts as an important buffer system to maintain the optimum pH. Alteration in bicarbonate and carbon dioxide dissolved in plasma, so these will cause acid-base balance. Okay. So again, determination in serum bicarbonate is by ISE technique, ion selective electrode technique. So here, this is determined by photometric rate reaction. Bicarbonate reacts with phosphoenol pyruvate in the presence of phosphoenol pyruvate carboxylase to produce oxaloacetate and phosphate. So the oxaloacetate produced is coupled with NADH in the presence of malate dehydrogenase, and it will form NAD. Okay, oxaloacetate reacts with NADH and it will convert NADH into NAD. Okay, so the consumption of NADH to convert oxaloacetate to react with oxaloacetate will decrease the absorbance, and this absorbance is monitored by UV spectrophotometer in the range of 320 to 400 nanometer. So the rate of change is directly proportional to the concentration of bicarbonate. Okay, so this is done photometrically, and when there is reduction in the extracellular fluid hydrogen ion concentration, so the condition is called as alkalosis. So the kidneys fail to reabsorb all the filtered bicarbonate. So this increases excretion of bicarbonate. So this is how it balances. Okay, in acidosis, what happens is the kidney do not excrete the bicarbonate in the urine, but reabsorb all the filtered bicarbonate and produces new bicarbonate to reduce the to balance the acidic. Okay, so hypernatremia and hyponatremia. So these are the electrolyte imbalances we observe usually. Hyponatremia and hypernatremia, hypokalemia and hyperkalemia, hypocalcemia and hypercalcemia, hypomagnesemia and hypermagnesemia, and hypophosphatemia and hyperphosphatemia. Okay. So in your next class, we will discuss about the electrolyte replacement or replenishment therapy. Okay. So if you have any doubts in today's class or previous class, you can ask. You have any doubts? Anusha?
Yes, sir.
You have any doubt?
No, sir.
Did you listen to the class?
Yes, sir.
So did you understand the concept?
Yes, sir.
So in summary, so we will determine the electrolytes by three major methods. One is ISE method. Okay, so and then one is ISE method, and another one is by flame photometric method, and another one is by using UV spectroscopy. Okay, so the one more method is by using LCMS. Okay, so these are the four different methods that are used to measure electrolytes. Okay, sodium, urine sodium and serum sodium is measured by ISE technique, and potassium is also measured by ISE technique. Calcium, aldosterone is measured by LCMS technique, and calcium is measured by ISE technique. Chlorine, urine chlorine is measured by flame photometric technique, and bicarbonate is measured by UV spectrophotometric technique. Okay. Gautam, is the concept clear to you?
So what is vacuate?
Vacuates means, I'll show you. Vacuates are the containers used to collect and store and prepare the samples. Okay. So I'll show you the vacuate. Let me share the screen. I think you have seen in the pathological labs. So these are called as vacuates. These are called as vacuates. I'll show you. So the advantage of using such containers is Gautam, please mute for a moment. When you're talking, you can unmute. So these are called as vacuates. Okay, so I'll just Google and show you different pictures of vacuates. vacuates. These are used to collect the body fluids. You are able to see the image,
Yes, sir.
Gautam? Okay. If you want, there are many videos I'll play and show you. So how these vacuates are used. The very advantage of this vacuates is so they are designed in such a way that their lid is self will have a self-sealing rubber, and when you transfer the fluid, it is completely isolated from the outer environment. Okay, so the contamination possibility is very minimal. So that is advantage of this. I don't know, I'm not able to access the video. Okay, so this is very commonly, these vacuates are commonly used in collection of blood samples. Okay, so in your next class I'll show you how vacuates are used in the labs to collect blood and serum. Okay, so in your next class we will also learn how serum is separated from